last time, hopefully.
Okay. Hi guys, it's Taylor and Sarah here again today. We are bringing you facts about coronavirus that we have gotten from the wellness director here on campus, Dr. Kathy Baskett. We are trying to alleviate some of the concerns and fears that go along with this disease. To begin, what are the symptoms of the coronavirus?
So the main symptoms of COVID-19 is a fever above 100 degrees, severe cough, and shortness of breath. If you have any of these symptoms right now, or if they develop, please contact our director of nursing on campus, your nurse manager, or a resident liaison to inform them of your symptoms. So who is at the greatest risk of COVID-19?
The people that are at the greatest risk are older adults and anyone with a compromised immune system. The virus attacks the lungs and is often the proverbial straw that broke the camel's back in an already ill person. So anyone with those diseases will be at a higher risk. How does a person get the coronavirus?
Well, you can get infected with the virus by coming into direct contact, being within 6 feet of someone who has the virus, and sharing their droplets. So COVID-19 is spread by the droplet method, just like the common cold. When someone is coughing and sneezing and they are not using good hand hygiene. So make sure that you are washing your hands as frequently as you can and not touching your face. So what about the virus being detected on surfaces such as doorknobs and your phone and handrails?
Yes, so just because the virus is detected on a surface does not mean that it is active or transmissible. It is important to just not touch your face and wash your hands often. An interesting experiment that any of us can practice is count how many times throughout the day that you touch your face, including your eyes, nose, mouth. It's important to not touch your face at all through these times, or any time at all. Why is the number of coronavirus cases increasing?
So currently we are seeing an increase in the number of cases is because we are testing for the virus. There are test kits available and the laboratories have ramped up to run these tests. Over the next 2 weeks, the number will rise and it will appear as if things are getting worse, but not necessarily. We now know what to look for and we are continuing to test. So who should be tested?
People with defined symptoms should be tested for the virus. Those are the symptoms that we went over before. Remember, not everyone with a cough or runny nose has the virus. In fact, most don't. There is still sicknesses out there like flu, influenza, colds. With the spring coming up, also allergies are surfacing, so watery eyes and runny nose will be more common. Why do we have to isolate?
So the reason for this right now is to slow the spread of the virus to those who are most vulnerable and so we don't overflow our healthcare system. This way, the necessary care can be provided for those who need it most. Think of it in a manner of which forest fire is contained by creating a fire break. However, in due time, hopefully sooner versus later, we all need to get back to life. We need to develop what is called herd immunity. Herd immunity is protection in a community from an infectious disease when a large percentage of people, typically at least 50 or 60%, become immune. They become immune either by getting the infection and getting better or by getting vaccinated. Since the majority of people in a community are then immune, there are fewer people who can become infected.
In summary, the best things that you can do to take care of yourself is what we just went over. Strengthen your immune system to prevent infections.
Sleep is restorative.
Eat well.
Although toilet paper may be in short supply at the grocery store, fruits and vegetables are not.
Exercise.
Manage your chronic diseases.
Maintain positive relationships.
Be kind to others.
Be patient with others.
Do not panic and let fear rule you.
Do not consult Dr. Google.
This too shall pass.
Hopefully we will remember the positive things that we have learned and get back on track to healthier habits. Most people who develop COVID-19 will be fine. Remember, you are not defined by your circumstances, but how you choose to respond.
Thank you for tuning in with us again, and remember that here at St. John's United, we have so much life to live.
Okay.